I did my PowerPoint on the disorder schizophrenia. What is schizophrenia? Well, schizophrenia is a disorder that affects a person's ability to think, feel, and behave clearly. Schizophrenia is characterized by thoughts or experiences that seem out of touch with reality, disorganized speech or behavior, and decreased participation in daily activities. Some of the symptoms that we can see, well, they're characterized into three categories. The first one is positive symptoms. Those are things that we cannot see, like hallucinations, delusions, movement disorders, confused or incoherent thought and speech. They're things that are going on in their head, telling them what to do, what's right and what's wrong. The negative symptoms are loss of emotion, lowered amounts of energy, low motivation, difficulty speaking, poor social skills, or lack of interest to socialize and affect flattening. So these are things that we can see in their everyday life. Cognitive symptoms are slowly losing interest in hobbies or activities that one used to enjoy are no longer being able to carry out simple instructions without supervision. So these are things that we can also see that are going on in their brain, but it affects how they live. Schizophrenia is characterized into different types. The first one is paranoid. Paranoia is also known as a positive symptom, so this is what we cannot see. Disorganized is disorganized in their speech and behaviors, and this is pretty obvious. Undifferentiated showed more than one type of predominant symptom, so it's the things that we can see that are pretty dominant in the way they live their life. Residual are people who were diagnosed with schizophrenia early but did not show symptoms later in life. Catatonic, people who showed signs of mutism or developed a stupor-like effect. So you can see this on their face, the way that they interact with people. So what causes schizophrenia? There's no main cause, but the two main factors are genetics and the environment. Schizophrenia can be hereditary, passed down from parent to child, or exposure to toxins and taking psychoactive drugs like LSD can cause this disease. So if your one parent has it, it's 10% chance. If two, it's 40%. And some of the ways to treat this disorder, there's no cure to the disease, but the more you're educated, the better you can understand it. Psychotic episodes can be reduced with therapy, social skills, rehabilitation, stress management, and antipsychotic drugs. Eating the right foods, avoiding drugs and alcohol, and getting enough sleep can also help to reduce symptoms. So all these things go into play when you're trying to reduce it, but there is no cure. And the last slide that I have is a link you can click on to hear the voices of schizophrenia. And this is really scary to listen to because it's all these different voices telling them what to do. So it's really putting yourself in their shoes.